urine specific gravity and osmolality. Specific gravity is a ratio comparing a substance's density to a reference substance, usually water, making it a dimensionless number that indicates if something will sink or float. Specific gravity of urine is measured using a urinometer calibrated from 1.000 to 1.060. The temperature of urine affects the volume of urine, thereby affecting the density. Therefore, it is important to measure the urine temperature as it is used to make the correction to get the actual urine specific gravity. We'll come back to the temperature correction later. To measure the urine specific gravity, you must have the following materials: a urinometer, a thermometer, which reads from 0 to 50 degrees Celsius, a 50 milliliters measuring cylinder, and a sample of urine, approximately 40 milliliters. To measure the specific gravity of urine, put the sample of urine into the measuring cylinder. If the urine sample is small, dilute it with water at a known percentage. The urinometer is then gently floated in the urine. Wait for it to settle. The urinometer must not be in contact with the sides of the measuring cylinder. The depth to which it sinks is observed directly from the calibration and recorded. Using a thermometer, the temperature of that sample of urine is measured. Now that we have all the measurements, let's do the necessary calculations for the temperature correction. The specific gravity of distilled water is 1.000 at the temperature of 20 degrees Celsius, which is what we will take as the calibration point. For every 3 degrees Celsius higher or lower than 20, 0.001 is either added or subtracted from the reading respectively. This is our final reading. The urine-specific gravity indicates the kidney's ability to either concentrate or dilute urine. A low specific gravity means the kidney is unable to concentrate urine, usually due to problems with the kidney or endocrine disorders, whereas a high specific gravity indicates the kidney is unable to dilute the urine, in conditions which causes glomerular dysfunction, giving rise to glycosuria and proteinuria, making the urine more concentrated with solutes. Now, let's talk about urine osmolality. Osmolality measures the total concentration of dissolved solutes per unit weight of fluid. It determines the movement of water between fluid compartments. Let's see how we measure urine osmolality.
Can everyone see? So this is the osmometer. If I'll explain what these things are. So this is the chamber where the chamber cleaners are and the sample tips are, and this is the pipette in which we get the samples from, and this is the chamber cleaner. It's supposed to be like this, like we have to insert it after every use. So this is basically the machine, and this is the digital panel where you get your results. It's a touch screen, so you can use that like that. And these are the calibration solutions. You know how before we use any machine, we have to check whether the machine the measurements are correct or not. So to do that, we use these solutions. So these solutions are calibrated so that these exact values are usually read out by the machine, right? So if I open one of these come in ampules. Do you know what an ampule is? So this is basically an ampule. You will see these things in the world more often. You have to, these are made of glass. You basically snap it open, and yeah, so basically these are the calibration sets, and this is the reference solution. So this is calibrated so that the reading should resemble the normal serum osmolality. What is the normal serum osmolality?
300.
Yeah, 295 to 285 to 295. Yeah, so this is calibrated, so it will represent that.
Using the pipette, collect the sample of either urine or serum.
Then we remove the chamber cleaner. Then we apply it like this. Right, so once we loaded this up, we can do this. So it's now testing it. There will be a like exploding sound. Don't worry, it's the normal for the machine. That's no. That's no. Yeah, it's 298. So once you get the value in screen, and you can also get it in the waveform. I'm terrible at ripping this. Can someone read this? So you get a value like this. Okay, so there are spaces to enter the patient IDs and stuff. So once the measurement has been done, we have to remove this and remove the tip. This we cannot use this again. Okay, so remove the tip and clean the tip with the cotton or whatever. Then we get another sample tip and insert it like this and keep it over here. Then we have to also clean the chamber. So these are the chamber cleaners. We get a new one. So we clean it like this. We have to rotate it once or twice like this and keep the other side in like so. So this is how it's supposed to be after every use.
There are many benefits of measuring urine osmolarity. Like with a specific gravity, it helps to assess the kidney's concentrating and diluting ability. It also helps evaluate disorders of water balance, such as in conditions like hyponatremia, dehydration, and so on. It helps us differentiate the causes of polyuria and polydipsia, such as diabetes insipidus and primary polydipsia. It also helps us to assess the action of ADH. It also aids in evaluation of acute and chronic kidney disease, where low or inappropriately fixed urine osmolarity suggests tubular dysfunction. And finally, it is important in monitoring response to therapy.